Hello and welcome to PsyPoints. Normally in this channel, I try to make things as humorous and lighthearted as possible when talking about a topic, but today we're going to be talking about a much more serious topic, so forgive me if I sound more serious than normal. Every September, the entire world acknowledges this month as the Universal Suicide Awareness Month. As a mental health organization, I want to take time out of our normal upload schedule to talk about this sensitive topic together. A lot of people, and myself included, have no power or qualification to give professional aid, which makes it difficult to help those in need ourselves. So, today, rather than explaining what suicide is and other statistics about it, we here at SidePoints would rather help spread awareness on how to see the signs of it and the best ways to help despite lack of experience in the mental health field. There are a number of warning signs or risk factors that you can try to keep an eye out for to try and prevent the worst from happening. If a person ever talks about killing themselves, feeling hopeless, having no reason to live, being a burden to others, feeling trapped and unbearable pain, these could be signs of them having suicidal thoughts and should be taken seriously. There are also certain behaviors which may signal risk, such as increased use of alcohol or drugs, looking for a way to end their lives, such as searching online for methods, withdrawing from activities, isolating from family and friends, sleeping too much or too little even, visiting or calling people to say goodbye, giving away prized possessions, aggression, and fatigue. If they don't talk about it or exhibit these behaviors, lastly, often people who are considering suicide can display one or more of the following moods, such as depression, anxiety, loss of interest, irritability, humiliation or shame, agitation or anger, or sudden relief or improvement. Again, these signs should be taken seriously and should not be played off or ignored as simply drama or messing around. While a lot of articles mention numerous means in helping a friend with suicidal tendencies, here are the top 4 ways you can do this even as a non-professional. At times, what your friend needs isn't advice nor a solution to their problem. Instead, try to stay in touch with your friend, even if they claim to be fine. It can be as simple as messaging your friend to ask how they are in that given day. When your friend mentions suicide to you, it's a good sign that you should initiate in asking your friend in talking about it. Your friend may feel reluctant in talking about it immediately, or you yourself may be unsure how to respond once your friend talks about it. But what matters is that you show that you're willing to listen to the inner pains your friend may possibly keep to themselves. Maybe what your friend genuinely needs is an empathetic listener. Don't believe in the myth that people talk about suicide to get attention. Invalidating them is the same as ignoring the warning signs of suicide. What's worse, they may become more reluctant to share with others if you yourself ignore them. Take note of what they say and take action on it. When you notice your friend is showing worrisome signs of suicide or hasn't been showing any improvement, it's about time that you encourage them to seek professional help. While it's good to be a supportive companion with them, there's a limit to what you can do, mostly due to credentials and expertise. It sounds scary, and honestly, it can be. But a little push may be enough to help them successfully recover. These are just the main ways we can help. However, knowing is only half of how you can show support. Here are some ways one could manage these feelings personally and spread awareness to others on mental health as well. Apps are another excellent resource that can help us with our own mental health. But it's important to remember that not every app is effective. In fact, some may end up doing more harm than good, especially when you have a severe mental condition. Luckily, experts have looked into these apps and identified apps that follow guidelines such as mood tools, calm harm, and stay alive, which have been shown to be effective. There are, however, apps that may be helpful to people who are going through a rough time but do not necessarily have a severe condition. Apps like these may help ease distress. They'll be shown briefly on the screen, and links will be placed in the description of the video. Again, while psychologists suggest that these apps are helpful, it's important to have additional support. These apps should augment therapy or professional help, not replace it though. The number of mental health organizations in the Philippines have been steadily growing. Here are just a few that we found that all bring awareness to mental health or provide some services to those struggling, which will be shown briefly on the screen. They all strive to bring more awareness about mental health and to eradicate the stigma of having a mental illness. All these organizations will be linked down below if you're interested in supporting them or looking for help yourself. Lastly, if you're ever feeling at your worst and have no immediate access to supporting figures in your life like family or friends, you can always call any of your local suicide hotlines and be guided by a professional. There are plenty to choose from based on your service provider, but I'll show them briefly on screen and link them down in the description below. I usually just ask for a like and a sub to help our personal growth near the end of these videos, but today, actually, I only asked to share the video to help with spreading awareness this month. And if you know anyone who's struggling with their mental health, just let them know that they're not alone. To anyone who's watching this, I want you to know that you're not alone either. So to end this video, a few of our members here have recorded some of their personal messages to all of you. Thank you for watching, and I hope you all take time out of your day to take care of yourselves and spread love.
This message is for everyone who's struggling currently with their mental health, and just generally for anyone who needs to hear this.
Hi.
Hello, this is Kyla.
My name is Ali.
And please excuse me for being Kermit. I'm just not really comfortable with showing my face. Anyways, sometimes things aren't really easy to deal with.
Honestly, it's not a secret that a lot of us are struggling with mental health. It's the pandemic.
Sometimes terrible things, whether big or small, can or will happen.
And aside from that, there's a lot of things that are happening right now. A lot of issues, a lot of problems. None of us are having an easy time right now, to be honest.
The real world is difficult, for sure.
And that's okay, really. Because a lot of us are not feeling okay, then that means that you can always remember that you're not alone.
You aren't alone. I know it may seem like it, but you are valid, you are seen, and you truly belong here.
As someone who has struggled with suicide before, and still currently struggling with mental health problems, I want to say that don't be afraid to reach out to people.
Talk to someone you're comfortable with, and not be afraid to reach out for help or guidance. I understand that sometimes it's difficult to ask for help.
There's always going to be at least someone who will try to understand you, to want to understand you.
Know that you don't have to shoulder your struggles alone. There will always be people who care about you and be willing to help you and support you.
And even if they can't completely understand things from your point of view, they're still there to listen. They're still willing to help in any way that they can.
I'm not gonna say just be positive or look at the bright side, since it isn't really good to ignore how crappy something is. The advice I give to you is to not bottle up nor ignore your feelings and just let it flow. Not being able to process your emotions would not only affect you mentally but also hinder you from healing.
But it will get better. It's cheesy, but it's true. It will get better, and you'll get better.
Honestly, this is all easier said than done, so it's perfectly understandable if you struggle with it.
And I hope that you eventually learn to forgive yourself on your worst days.
There's no need to rush the process and take your time to heal.
The struggle is real, but so is recovery. So please take care.
You are never alone, and please do take care of yourself.